Hello, everybody. That was for those who were here in the last session, that was quite powerful. And hopefully we can build on what was discussed at that time. But I wanted to first greet everyone. Selamat petang. Good afternoon, everyone. It is really a distinct pleasure to be here today for many things. First, to welcome you to this session. Second, I am super grateful that I'm actually here because I was almost not going to be able to make it. I was stuck in Istanbul because my flight was delayed and I did not make my connection and I wasn't sure I was going to be here. But I'm here, and so the stars aligned and you guys got me. The third distinct pleasure is I'm really, really grateful to be here running a session at the 6th Annual Planetary Health Alliance meeting that is hosted by the Sunway Center for Planetary Health, which was a vision that a few of us put together a few years ago, and along with a dear friend and co-visionary, Dr. Jamila Mahmood, who's made this happen along with Sunway University and Planetary Health Alliance. It is an amazing, proud moment to see this in full force. And then I also am having a distinct pleasure and honor to have in this session, joined by my colleagues, friends, fellow humanitarians, human rights, and planetary crisis responders with us today. Before I introduce them, I just wanted to give a little bit of housekeeping. I know that this was supposed to be a slideless, mixed media, mixed talk, fireside chat. It's all in one. So some will speak without, some won't, and I will myself start with one. And then we're going to try to, as we already are late, we're going to try to go as short as possible in our presentations, but hopefully allow you more time to have a Q&A. And I'm aware that that's not always been possible in this last few days. But to introduce my panelist, esteemed panelist, we're joining. So there are two women here, whereas, and then of course, all men. But I just wanted to first introduce the first woman here, other than myself, is Miss Ling Rodriguez, who is a dear friend and is the Deputy Director General of Médecins Sans Frontières, Doctors Without Borders, the organization that I work for as well, at the operational center in Geneva. So she did have a pass for Switzerland. She is the sponsor for the organization's planetary health strategy and oversees the engagement with the global partners in West Africa, Middle East, and Asia. She is a Canadian humanitarian professional with over 20 years of working and managing operations in the different regions, along both either with MSF or the Red Crescent movement. And we are also joined by the youngest one in the group, I assume, is Dr. Peter Gahn, who is a multidisciplinary public health physician who is a budding humanitarian at heart. He aims to improve health equity and advance sustainable development by bridging the gap through delivering primary health care to underserved populations while shaping evidence-based policies, practices, and research. He is a volunteer for Mercy Malaysia and is also affiliated with the Ministry of Health in Malaysia. We also have Professor and Dr. Janaka, Jayawickrama, who has been responding to crisis actually in Asia, Africa, and the Middle East over the past 30 years, mainly in collaboration with the community. He has founded many postgraduate programs on disasters, development, and humanitarian affairs, and with universities in the Global South and North over the years. He is currently a distinguished professor of social anthropology and director of Research Center for Health and Wellbeing in Shanghai University in China. In his capacity, Janaka's main focus is to learn from ancient knowledge systems to find possible solutions to present-day challenges, including the crisis of the planet. We are also joined by Rajat Khosla, who has 2 decades of expertise working at the intersection of global health, equity, and human rights, and has contributed to the Institute of University of UN University here based in Malaysia, serving as the Senior Director for Research, Advocacy and Policy, also at Amnesty International in the past. His current affiliations has been the WHO Advisory Group on Gender Equality, Health Equity, and Human Rights, and has been running the Gender and Health Hub for the UNU High-Level Advisory Committee. He is he's a big climate justice fighter, and so looking forward to hearing from him as well. And then last but not least, we have Bruno Jochum, who is Executive Director and founder of the Climate Action Accelerator, which is a non-for-profit initiative based in Geneva, aiming to support aid in health organizations to halve their emissions by 2030 and build a transnational community of practice that shares climate solutions through open source. His background is in international relations and international law, and has a long history of working in humanitarian settings, starting from in the Horn of Africa during the Rwanda refugee crisis in Goma, and then joining MSF as well, Doctors Without Borders, in 2001 to 2018. Before he left, he was the general director of the MSF's operational center in Geneva. So with that, I'm going to start our session. And I thought perhaps it would be best to zoom out, since we're speaking about planetary crisis, to first zoom out and listen to what is that planet that we're talking about. And I was wanting to hear a little bit from the pale blue dot introduction of Carl Sagan, if we can put that video on, just to remind us of where we started. Next slide.
There are now 4 spacecraft which are beyond the orbit of Neptune and Pluto, Pioneers 10 and 11, Voyagers 1 and 2, 4 vehicles of our species plummeting into the interstellar dark. Now, of all those worlds, we have no indication of life. For me, that underscores the rarity and preciousness of the Earth and the life upon it. And you can see that it looks like more than a dot, but it is in fact less than a pixel. You can see that it's slightly blue, and this is where we live, with a blue dot. On that blue dot, that's where everyone you know, everyone you ever heard of, every human being who ever lived out their life. The very small stage in a great cosmic arena. Just speaking for myself, I think this perspective underscores our responsibility to preserve and cherish that blue dot, the only home we have.
So if we learned anything from the last session, we only have this home and we better save it. But it is impacting. Oh, can we? Yes. And what we see with that pale blue dot, if you go closer and take a picture of it, is this blue marble. And so this first photo on the, I guess, on your left side was taken in 1972 and from the Apollo 17. So journey into space, we got to see what Earth looked like. 50 years later, this picture on the right was taken in December 2022. And significant changes can be seen from the face of the Earth. So with the wear and tear that we've caused our Earth, this pale blue dot, this blue marble, is very evident. And one of the most striking things that you can see there, even though it's not so obvious in the naked eye, is the reduction, for example, of the dark green areas of vegetation in the African region, you can see both of those are reflecting that. And particularly in the northern extent, where you could see the dark shadow of the Lake Chad in the northern Sahara has just shrunk. And the forest vegetation has now started much later. If you take an even closer look, you can see how the Lake Chad has shrunk in this last 40 plus decades by 90%. That has significant impact on the people that are actually living around that area. And if you zoom even much more close, next slide, you see this is the reality on the ground. So when we talk about planetary crisis, we talk about, there's three that is in our face today, and if that we've already are transgressing. There's the challenges of the air pollution and water insecurity that we just heard about. We know about climate crisis, and we know also about biodiversity loss. All those are compounding together, causing significant impact on the people around the world. And so this picture in Chad is a project by MSF, where you see ladies trying to carry water, trying to seek water and trying to find it from the MSF distribution sites and other organizations' distribution sites, but they're very, very far and few between. But to speak on that, I think it's time to actually start with our first panelist, which is actually Ling, who will speak to this because this is the project that they actually run. Ling, over to you. If you want.
Fire chat?
This is fireside chat.
I think I want to be
Sorry.
fire chatty.
Fire chat.
It's too bad we don't get the musical introduction with the band and the sax player, but bear with us. So,
I'll run your slides.
okay, thank you. So I want to talk to you about three things: evidence, relevance, and collaboration. And so when we talk about evidence, I want to share a little bit about the recent article published by my colleagues in the PLOS Climate, where it's clear that we have evidence that the human health impacts of climate change are severe, they're widespread, and they're increasing and they're worsening over time. So before I get to Chad, I do want to say that globally speaking, we see that 69.9% of annual global deaths are due to climate change, human health impacts of climate change. And what does that look like for MSF? For MSF, that looks like an organization that is now running programs in over 70 countries. And to give you an example, in 2022, we had we treated 4.2 million cases of malaria, and only the year before we were at 2.6 million cases. In the example of malnutrition, in 2022, we admitted 137,000 malnourished children into therapeutic feeding, and only the year before, this number was at 82,000. So on a global level, we're seeing the impact as well. And at country level, I cannot not speak to you about Sudan this week, because Monday marked the 1-year anniversary of the most recent, most brutal, colossal war in Sudan. And there we're seeing a huge, huge impact of 8 million people who have been forcibly displaced from their homes. And a lot of them, in fact, according to the UNHCR, 25 million people are in need of humanitarian assistance today, which is half of the population of this country. I mean, it's, you know, and as someone was saying earlier, you know, one case is a tragedy, but it's, you know, 25 million people, 8 million people. This is hard for us to really visualize, conceptualize. So here is a map of the climate sensitive areas, climate hazard areas in the world, and juxtaposed with the white dots show where MSF is working. So in fact, we are working in countries where we have this, as Maria was saying, compounding impact of war, displacement, malnutrition, and severity of health facilities, lack of access to facilities, not just physically, but also for political reasons. And it's not in the interest of many countries or people working in countries to provide access to people most in need. So this is the challenge that we're facing as MSF. And in the case of, I mentioned Sudan because a lot of the people in Sudan have fled across to Chad, to the border regions with Chad. And there we were suddenly confronted last year with 147,000 people who had to cross the border, and there was nothing there for them, nothing. This is a drought-stricken area. There was no access to water, and we had to suddenly put up a hospital. We ran 2 primary health clinics. We also are seeing cases of sexual and gender-based violence and malnutrition, of course. So all of these things are mixing together in a toxic mix of malaria, malnutrition, and really it spells a disaster really for people who are most in need. So that's one example. And I also wanted to share a brief story. There's a lot of speakers, so I will be brief, but in Mozambique as well, I had the opportunity earlier this year to see how we've adapted some of our programming, where we had primary health clinics in rural areas, and we had to we saw suddenly that there's a lot of cases of schistosomiasis and also of lymphatic filariasis. And these are 2 diseases that are mosquito-borne, vector-borne diseases, and that our teams ourselves, we're saying, well, why are we seeing suddenly 600 cases in this area? What can we do about this? So we talked together, sat down with the district Ministry of Health to look at what is possible, what is causing this, and this is the reflection that it's difficult, for us as MSF, 50 years of work, we have to break out of the cookie cutter, let's just build a clinic, let's just send the doctors, let's get the community health workers. And so in this particular instance, this summer, we decided we'd do together, collaborate and set up a surgery campaign to provide treatment for these 600 people that were suffering from lymphatic filariasis. And that will be just a temporary thing. Then we'll continue to see what else comes next. So brings to my point the issue of relevance. Our programs need to continue to be relevant to make meaningful change. And finally, to say that in terms of evidence, we need to collaborate because we don't have sufficient evidence to show that in humanitarian settings, there is that connection between human health impacts of climate change, conflict, and conflict. So here I call upon all of you here that are in the scientific, academic communities, NGOs, governments, to really come together and look at this, because according to the International Panel for Climate Change, there is documentation of some evidence, but it is insufficient for organizations like ours who are working at the intersection of all of these themes that we just addressed. So yeah, climate change is a crisis. It is a humanitarian crisis, but as humanitarians, we cannot forget that climate is also one of the huge risk factors, and we must address that together. We cannot do it alone. Thanks.
Thank you, Ling. So there is a call there for collaboration, and on that concept of bringing different entities together, I wanted to first get a little bit of more of an insight from the impacts perspective from the young budding humanitarian who wears a hat of a volunteer at Mercy Malaysia, but also has worked with the Ministry of Health, where that intersection happens from his perspective. Perhaps, Peter, you can give us a little bit of your insight. Thanks.
Yeah, okay, thank you so much. So I'm, as mentioned earlier, a budding humanitarian. So my experience is limited to the past few years, where I feel like climate change have impacted people tremendously. So a lot of humanitarians feel that climate change is something that is out or beyond humanitarian action, because it's something that is acute and you wanted something to bandage the problem at hand. And climate change is something that is developmental. So they don't really think about climate action in terms of humanitarian. So a lot of times it boils down to the development organizations to actually tackle it. But working in silos in terms of climate action actually precipitate the problem even further, because in terms of the impact of it, we feel it right in Malaysia in terms of the extent of the floods that we experienced over the couple of years. And I personally experienced flood on a personal aspect, and it actually sort of grounded me in terms of how bad it was. And over the past 20 years, most of the community actually say they have never experienced that kind of flood before. So in this instance, we shouldn't be working in silos where humanitarians will work separately and the development community will work separately. So we need that humanitarian development nexus to actually help consolidate that effort and also to mitigate the impact of climate change. Because if we don't actually do it, who is going to do it? And if we don't do it now, when? Because if we are waiting for the development to actually improve the action on the climate crises, it will be too late. So I think we need to work hand in hand, because I've felt I'm quite privileged or honored to have worked in humanitarian as well as in the development sector, to know that we cannot work in silos to actually achieve a global solution to what we are facing currently. And because of all these issues, most of the time, we are just putting a bandage on it and not actually addressing the root cause of it. I feel that if we work together, I think we could find a solution, and also to mitigate and also adapt to climate change in that instance. Because as you know, climate change, air pollution itself, with statistics that could cause, like it causes 5 million premature death for in NCDs because of climate change. And it's not just because of the impact of disaster, but also because of pollution, because of food insecurity. So one of the things I want to talk about is also vulnerability as well. So the impact of what this is affects the most vulnerable of us the most, especially the lower income, the marginalized, the disenfranchised, the indigenous community. So climate change in Malaysia, we actually did a study that shows that it affects women who are bearing children. So pregnant women have difficulty to access antenatal care in terms of their livelihood. It also gets impacted as well. So the marginalized community are severely impacted. And also the effect of climate change on prematurity for infants and low birth weights as well. So there are a lot of studies that actually shows that climate change actually have an impact, not just in development, but also in the humanitarian sector as well. So I think that's one of the important things that I wanted to bring out.
Thank you, Peter. I think you raised already the questions around bridging those silos, and for humanitarian who's been versed in the humanitarian development nexus. We have some UN people here, ex-UN people here, that we're a bit touchy on this, but because there's some specificity on it. I think what climate change and the planetary crisis is doing is highlighting that it's just one big spectrum. It needs to be much more fluid. And maybe you also highlight vulnerability, indigenous, and the community. And we have Professor Janaka here who can maybe speak to that. And I know your background has huge interest in looking at nature-based solutions and how to learning from the community from that. Maybe I can ask you to speak on these elements. I can do the slide for you if you, or you can do it.
Then I can see.
Perfect. Here you go.
It just-
And move out.
So I'm talking from two different points of views. Like, so first as a Sri Lankan, so I was 3 years old. I was actually 1 year old when the war started in Sri Lanka. This was 1970s. So all my life, as a child, as a teenager, as a young adult, I went through or lived through crisis. So that's one element. And then the second aspect is I'm talking as an academic, because most of the parents are interested about making their children doctors, engineers, all of that, get them a good livelihood. But we go to school, we stay at home, but we don't teach our children about planetary health. We don't teach children about engaging with nature. So that's something I got interested. Um, so it's not breaking. Um, Okay, so this is a quotation from one of my colleagues in Sri Lanka soon after the tsunami, to one of the humanitarian agencies. My dear sir, this may be your project, but this is my life. And that's the reality for most of the communities across the globe, regardless of. So it's not your project, it's not your 9 to 5 profession, it's a lifestyle. And that's very important to think about. Oh. Okay, so I'm coming from the Research Center for Health and Well-being. As Maria mentioned, we are quite interested to know about ancient traditional knowledge systems, mainly because, again, you go to Africa, Asia, Middle East, even in Latin South America, people are using their traditional knowledge systems in terms of survival. When there is a disaster hit, when a tsunami hit, it's not the humanitarian agencies comes, not the blue lights or red lights comes. It's the affected communities themselves take care of each other. When it comes to climate crisis, it's the same. And most places, there are no humanitarian agencies. And then also to understand health from a simpler point of view. I'm not necessarily saying that WHO definition has its own critiques and problems, but there are other definitions that we need to bring in. And also to understand well-being from a different point of view, because this image you see is Hurricane Katrina, 2005. So again, we need to understand the disasters and crises are happening all across the globe, not one place. And life in general is uncertain and dangerous. So how do we deal with that? And so these are some of the work we do at the moment in collaboration with various different organizations, including the UN Humanitarian UN Office for the Humanitarian Coordination, as well as Sunway Center for Planetary Health. And these are some of our focuses. Again, we talk about planetary health from different angles. That's quite important. So we talk about humanitarians and we talk about disaster managers. We talk about peace building community. We talk about different development communities. How do we bring people together? And I want okay. So if you think as human beings, as part of nature, we are also animals on this planet. And we completely forget that over the years. I'm talking years in the sense centuries, through our education, knowledge, all of that. And what we have done is separate ourselves from natural processes. So we have created our built environments. We have created our dams and roads and infrastructures. Again, I'm not necessarily saying they're bad. However, when there are pressures from us, our structures, our infrastructures, and so on, then only disasters happen. Because if there is an earthquake in the middle of a desert, nobody is affected, no infrastructure is affected, we don't call it a disaster. It's the human. It's our social, political, cultural, economic, and environmental structures create disasters. And in that, I want to pose a question. This is from North Central Sri Lanka, where elephants end up eating garbage because we have destroyed their elephant parts and their natural food habitats. Imagine a world where there are no earthworms or insects. As human beings, we have about 6 to 18 months to live. In return, if there are no human beings on this planet, the whole planet will flourish. So we need to understand the problem we are facing. It's us. And if we don't engage with the with nature, with humility, with care, and so on, we are going to be extinct. And that's the reality. We are not that powerful in terms of natural processes and natural systems. And again, we talk about development as creating equity for the future generations. But again, throughout the conference, you might have seen that we don't have equity in current day situations. In Africa, in Asia, in Middle East, in all over the place, there is no equity. So if we can't talk about equity today, we can't talk about equity tomorrow. And in that, I want to show you something quickly, is that when we talk about health and well-being, as I said, life is uncertain and dangerous. However, with most of the external interventions, including by the humanitarian community, they look quite useful, positive in the short term, but in long term, because they are dependent on funding, because they are dependent on external resources and so on, the community get into more crises. We have seen that after the tsunami. We have seen that after the Nepal earthquake. However, the community systems that doesn't generate greater well-being or health is sustainable. And as long as we are going to collaborate with people on the ground who knows their environment, who knows their natural systems, who knows how to engage with um, with with crises, we are not going to do any good. So in conclusion, I want to give you take-home points. Working on planetary health is not a 9-to-5 job. It's a lifestyle. We need to come out from professionalization of anything, because it's the mothers, fathers, farmers, fishermen. They are the people who are dealing with these issues. And also, it's not a competition to think who wins, because we are in different cabins in the same ship. If my cabin is good and I can't say, okay, I'm safe, not anymore. We need to take care of each other in collaboration. And also in that, we need to bring all epistemologies, different ways of thinking. You go to Southern Africa, you talk about dead ancestors and Ubuntu and human nature connections. We need to bring all of that. We can't say, oh, that's not scientific, not anymore. And more collaborations are needed as equal partners with care, humility, and collaboration. And knowledge is not just in research institutions and universities or academia anymore. It's everywhere with everyone. And that's all I have to say. And if we are not going to take care of ourselves, as one of the images says, we can't even follow our dreams. It's all will get canceled. Thank you.
Brilliant. I can't agree more. I like that planetary health is a lifestyle. I think we all need to own. One of the other things I do like about planetary health framing is that it focuses on the broken human systems and how it needs to really relate with the natural ecosystem, and that we are dependent, interdependent. Our health is dependent on the planet's health and all the beings that lives in it. On the messages of equity and humility, and we have an expert on human rights and rights to health sitting amongst us, who has actually been looking at this through the last 2 decades. I really wanted to hear from Rajat, really your perspective on how, having worked in the multilateral systems, seen face to face how policies are not really matching, how the rights issues are not being met, and how these inequalities really impact us today. In your work today, how does that look? You can speak from wherever angle you feel is most relevant at this moment.
Thanks, Maria, and thank you all very much. I'll be brief, but just to capture a few points, adding to what colleagues have already talked about. We are a policy think tank. We are the think tank of the United Nations working on global health based here in Kuala Lumpur. And what is interesting is that if you actually do look at these issues, and the dysfunctionality of the multilateral system, which you were very politely pointing towards, Maria, is all too startling. We are new into this thing. We are new into this thing in the sense that we are now within our institute's context, starting to look at these intersections and climate justice as a key area of work. But before we get to what we are trying to do in this space, it's just interesting to reflect on the three previous speakers and what, Maria, you've been talking about as well, is how do the humanitarian climate conversations interact with each other? And you know, for a while, we've been talking about the intersection between conflict, contagion, and climate as things that intersect with each other. And you said it very nicely, but you said that there is a spectrum of issues, therefore we need to discuss with it. We need a totality of approach, but unfortunately, and we saw that in the grand bargain as well, we have a very siloized approach with which we look at these issues. These are very separated and disjointed conversations. These are not very connected conversations. So before we talk about how these things interact with each other, we need to reflect upon that these things do not interact with each other when it comes to policymaking, programming, or funding. We are not having. So for instance, if you actually have people from Green Climate Fund or from environmental systems, they are not talking about health at all.
Mhm.
At all. We might have had the first Global Health Day at COP28, but the fact of the matter is that when it was COP21 in Paris, we were actually being told not to talk about health because it was a distraction from the climate agenda. So those interactions haven't really meaningfully taken place. But when they do interact, what does it mean? The first thing that comes out is that of disruption. And I think somebody referred to Chad and the African continent and how some of these issues are playing out. And I think there is no space better than the Sahel region in which you actually see the spectrum play out in a rather magnificent way, because over the last decade and more, you are having to see systematic decline in health indicators to the level that you have a 20-year age difference between Western Europe life expectancy and Sahel. There is 100-time difference in terms of maternal mortality in Sahel and in Western Europe indicators. So this is how the interaction happens, is by deepening and creating further vulnerabilities which the populations were already being subjected to. An unfortunate reality of that is that it ends up impacting those who were already most vulnerable: women, girls, children, elderly, indigenous populations, or those populations who are on the move. And unfortunately, there is very little to do, because the second thing that happens, well, alongside the exacerbation of existing vulnerabilities, is that of disruption. Disruption of services, of social infrastructure, of the mechanisms to respond to these issues overall. And we within the humanitarian space know how to deal with a certain kind of disruption, whether it is within the borders of a country through internal displacement or outside the country context through, through the refugee populations. But what happens when the populations are transient for a protracted period of time? We actually don't know how to deal with it. The recent data from UNHCR says that we are expecting now displacement to affect populations for up to 20 years. That's startling. 20 years is when a person who's born today, if is living in a country context like Chad, can be displaced for. So how do you respond to their healthcare needs? How do you respond to their developmental aspirations? And what would happen to that person? We quite frankly don't know. And then so the third point that becomes is basically the fallacy of our intervention models that we are working with. They simply don't deliver, because what we are doing is a patchwork solution to complex health systems issues which need to be almost rethought. I have often argued that resilience is an oxymoron today to be talking about. I don't think the term explains the kind of challenges that we are talking about, right? If you even look at Ebola in West Africa, And the three countries, as were starting to get impacted, or as COVID-19 played out in multiple fragile country contexts, there were no health systems to be resilient with. So you're actually having to now think about a reorientation model of health systems so that you can provide services through a pattern of disruptions, which unfortunately would be cyclical, right? If it is not conflict, it will be a climate-related or a disaster-related issues, or there might be a pandemic in another 5 years. And as many are saying, that is the new reality. And then just, so what does this all then start to show is that we do have a bigger problem because the systems of governance that are supposed to respond to these challenges are simply not working. So, within the multilateral system context, when we do look at whether it is, SURF model, whether it is search capacity models that we are looking at, they're just not able to deliver because the demand is also high today that we don't know how to keep on responding to. And this is where, if you actually look at some of the conversations that was starting to happen since the World Humanitarian Summit in Istanbul, which happened alongside as the world was adopting the Sustainable Development Goals, but so little has progressed on some of those things. And this is where the grounding in a justice-oriented approach, and this comes back to the point of why is a human rights framework, why is a legislative response, why is a justice-oriented framing important, is because it's not only about loss and damage, right? It is not only about looking at the populations who have been disproportionately affected, having contributed the least, but it is also about looking at the injustices that underpin to the effect that they don't have the capacity to cope with the adaptation, the mitigation measures that are being created for. Whether it's his populations living in the South Pacific, in the Indian Ocean countries, or the countries that are now being identified as suffering, extreme levels of heat stress. There is very little when you actually look at it from that perspective that we have in terms of coping capacities available. So I'm sorry, it is a fig leaf of protection when countries, if you look at what amount of contribution has gone into the loss and damage fund, it cannot respond to the needs that we are having. So unless we then go back and actually have a reorientation on the kind of the capitalistic structures, and somebody made a very nice point in the previous panel discussion, is that unless we challenge the power and the power asymmetries that are underpinning some of these things, unfortunately, our solutions are very short-lived. I'll leave it there, but maybe we can come back
Wow,
later.
so that was indeed powerful. But depressing, I know. I'm going to try to switch over to Bruno, who might give us a little bit of at least the little things we can do to try to topple that system.
Okay. Thank you, Maria, for the invitation. So a few words on the Climate Action Accelerator. We're about a 3-year-old non-for-profit initiative. And when we launched it, the idea was really to mobilize a critical mass of organizations to try to have a kind of front guard, really, taking commitments, but also experimenting what deep decarbonization means together with resilience at an organizational level. And in sectors like international health, international aid, research, etc., that actually inspires social trust. So it's both, I would say it's a humble experience, but it's a learning experience. And today we have close to 30 organizations on board. Some, oh, sorry. Okay. I'll move away. Okay. I hope it's better now. And so we have both very large organizations like International Committee of the Red Cross, Médecins Sans Frontières, UNITAID, which is funding many programs, but we also have national actors like in Sub-Saharan Africa, and mid-size organizations. Of course, the catch-22 for these actors is basically how do you go for deep decarbonization and resilience while actually having a very important social mission in society, while facing a very clear expectation of growth of needs and financial limitations? So it's a kind of a Rubik's cube. How do you actually solve this operationally in practice? And it's really the challenge most of our society faces. And so here we're not at the policy level, we're not at the citizen level, we're really about the how to operationalize. And this starts with, taking what we call real commitments. And because, I mean, what the science is asking, as you know very well in this room, is not just improving the situation. It's not just reducing a bit your impact, etc. It's actually going for a rapid and deep decarbonization in actually a very limited period of time. So how do you do this together with other planetary boundaries? So all the partners that we're working with, basically acknowledge this scientific situation and agree to work on a trajectory which is at least a 50% reduction by 2030 on the way to net zero, but excluding any offsets. So as you know, there are still today many private, many public institutions which do not necessarily measure all their emissions, which buy credits to claim carbon neutrality, etc. So all of this is excluded. Besides the principles, it's also about a community of practice, sharing to actually get the learning through, and with the hope of actually building generic tools and then capacity building programs for a larger group of organizations to actually really play a domino effect and to have a monitoring frame which allows to see progress. Next. Well, I'll do that. Is it? Sorry. So these principles, I would say, go with also direct support and support to implementation, and there are the cornerstone of this initiative. Now we've worked on two angles. One is really climate resilience at the level of health services. And then we've worked also at the whole of the organization level, which I'll describe later. And notably, our health team has been looking at what could a concrete approach look like at a health service level in a vulnerable country or developing country that actually integrates all dimensions. So resilience, adaptation, mitigation, low carbon development, and within an all hazards approach. And you'll be, sorry. It was inspired by WHO policy guidance. There's been some very good documents issued, but what has been severely lacking until now, there are very few actually practical experiments of these comprehensive approaches at the level of districts, of hospitals, etc. There are a few around the world, but they need to be actually implemented at a much larger scale. And our team has been basically developing a vulnerability and capacity assessment tool, which is really based on a very inclusive and participative process with staff, with community, with those leading programs, to really try to select the different solutions that actually apply to their context and helps to design basically what a climate resilient and sustainable hospital can look like, but also primary healthcare district. So this is being experimented today in Chad with one of our partners, and also with Stellenbosch University in South Africa. And we hope to open during the course of the year 3 other projects to actually test this approach. I would say what is interesting here is that You know, a lot of works on climate resilience and adaptation focus on infrastructure. So it's all about buildings and energy. But here, it goes much wider. It goes on, it includes the health workforce, it includes the programmatic approaches, what you provide to populations, it includes the funding, the waste, etc. And the question is how to do it comprehensively. So this, I'm not going to, of course, list the many types of solutions that are included in this approach. But what it means is that you combined classic energy and building adaptation solutions to actually much more, you know, unusual solutions in the resilience aspect, which is basically improving really healthcare services like reinforcing blood banks because you're going to face malaria peaks, like developing seasonal calendars, including epidemics, floods, etc., to actually adapt the programs. And this can all be done locally. At an organizational level, we've been publishing a number of climate and environment roadmaps with some of the organizations we are working with. And these basically are an exercise of collective intelligence to really select what is the right combination of solutions, organization per organization, in the different fields and emission sources. So you're going to find, obviously, transport, procurement, energy and buildings, you know, waste and ecosystems, etc. And because these organizations are actually mass consumers, they have a social mission, they're aware of the crisis, but they are mass consumers of goods, of service, of construction materials, of transport. And the question is how to, again, operate delivering what can be done for populations, but within planetary boundaries. And it's a quantified approach, which is also a key principle. This is not about just intentions. It's actually about quantification. So taking into account, you know, the precise footprint analysis and building trajectories of how each potential lever can influence the reduction of emissions over time. Because the natural trend of any organization today is actually continuous growth of emissions. And this is, it's important to understand. It's not as we're not even at the moment where it's stabilizing. The trend of any organization which is dynamic is continuous growth of emissions. And what the macro level, the policy level can bring only partially addresses the effort that has to be done within an organization. And what, you know, what belongs to industrial policies, to macro policies, etc., usually, you know, I would say covers about 1/3 to 1/4 of the effort an organization has to do to actually be in line with Paris Agreement targets. So it's an important finding. We also look at the costs that come with these deep decarbonization trajectories, which also include environmental impact and other aspects. And we were actually pretty surprised to consistently find that, you know, at the beginning we were expecting, well, this is going to cost a huge sum. It's going to be, I don't know, 20, 30% more. So almost, you know, impossible to implement. We've been, you know, consistently finding actually net costs of between 0 and 1% for these type of organizations. So you have obviously investments, you have return on investments, you have running costs, and you have savings. And certain areas actually bring savings. And the question, I would say one of the challenges is really, you know, if every single organization was to do this exercise, it would quickly realize that, yes, it's an effort of change. It needs, you know, good governance, it needs determination. But, you know, investments of between 0 and 1% is the daily bread and butter of any manager of an organization. It happens all the time on so many different things. And here we're talking about an existential threat. And it's, and when you also take into account the co-benefits, etc., I mean, the case is pretty clear. It's also about organizational resilience, because what probably is underestimated by a lot of organizations in this sector is how much the pressure on energy costs brings an inflation on the functioning of the organization, which is eating away margins of maneuver. And we've seen in many of the partners we have that even when they grow financially, the projection of inflation, which is largely led by energy prices, is actually eating up the margins of maneuver. So what it means that deep decarbonization processes actually are critical to operate better and more in the future. Because the more you move away from fossil fuels that are everywhere, in the good production of goods and service, in the transport, in the buildings, etc., the less you're going to be exposed to actually tensions on the energy side, which are very real. And they're very real in developed societies, and they're very real in developing societies. And when you talk to national partners in, for example, the Sahel, they want solar panels and renewable energy, not because so much of the emissions going down. They want it because it's becoming cheaper and it ensures continuity of service to populations. Whereas fuel supplies are much more insecure and with a high volatility of prices. So it's really important to understand this. And finally, I would say all of these learnings, we conceptualize them into an acceleration model that basically we're developing, which is the laboratory I described at the beginning with pilot programs, the capacity building with the idea of touching many more organizations to actually transfer knowledge, transfer know-how, etc. And finally, what we call a domino effect, which is really about amplification at sector level. And this is where it becomes interesting in terms of tipping strategy, because basically from these experiences and aside many other initiatives that contribute to this, you can actually engage systemic players. So you can engage donors, you can start working on sectoral roadmaps and recommendations, and you can really basically, I would say, turn the trend in a sector within a few years. It's possible, probably health is a much larger sector, but international aid is a smaller sector. And yeah, it remains something effective. So I'll stop there.
So thank you, Bruno, for giving us some solution ideas. So if resilience may be an oxymoron, but maybe at organizational level, we can do something about it. And I think it's come back full circle on what Ling started with, the evidence, impact, and collaboration. So there is this tipping point and critical mass. We're running almost too late, but since we started late, I'm going to take the liberty to ask, to open a bit for some Q&A, because unfortunately we didn't have the full 90 minutes. So I'm going to give at least 10 minutes for Q&A for you guys. If there are any questions from the floor. Gentlemen here. I think the mic's coming.
Thanks a lot, Felipe Camargo. And I mean, 30 years of humanitarian work with different UN agencies. And thank you very much, because it's really, really powerful content when it comes to what are we to expect as humanitarians in a world like this. But I feel that there are certain elements missing. And as a humanitarian, retired humanitarian from the comfort of my retirement, I wanted to ask more specifically about projections, because we've been talking so much about the potential impact of displacement, the potential impact of climate change, but where, when, and how. Where, when, and what? We don't know what's gonna happen. I think we all know that a lot is going to happen, but we probably don't know necessarily, we have not targeted enough the where's and how we're going to respond. That's one point. The other one is that I still feel that we're talking about the same emergency response, because development has failed. I really appreciated your presentation. But what is it that needs to be different? And we're talking here about responding to challenges related to the planet, to nature, and I feel that there is something missing when it comes to how much do we need to recover nature and the health of the planet to reduce the risk of emergencies. I mean, what is it that needs to be done? And I'm pretty sure we are late. It's very difficult and it's very depressing and it's very sad. But when I see some of these projections that Bruno was presented, it's like, when is it going to happen? When is it that we're going to start dying? And it's very dramatic, but I think it feels a little bit like that. When and where? Because what we are doing is not necessarily addressing the root causes of those natural risks that we have. And I think it could be late. So sorry, thanks. Thanks,
Thank
Maria.
you for those two. I'm going to take another comment, question from the floor, and then I'll turn back to the panel. I think there's one from the peanut gallery. It's a dear friend. Oh,
I mean, I basically want to follow up on what Felipe was saying. We were having some interesting discussions yesterday. And I'm increasingly worried that we're sort of planning for a reality which is no longer a reality, which is the 1.5. When will the humanitarian system start planning for 2.5 or 3? Because the parameters shift considerably when you start to look at that. But that may be where we're headed. And if we are, it changes the way in which I think we start to collaborate with development actors, with political actors, and it changes very much the advocacy that should be coming from the humanitarian system that I'm frankly not seeing. I'm not seeing it in a joined up, coherent way. And there are reasons for that around dealing with immediate crises, Ukraine, Gaza, what's happening across the Sahel, and so on and so forth. But there's a need, I think, to start, for the scientists amongst the humanitarian community to start looking at this and start raising the alarm, because otherwise we're really in a bad place.
well noted. I'm going to turn back to the panel. Any response to any of those? The first one was on projections, where, what, when, what, and will we see anything that sticks together? And then the other is what do we need to recover? When do we move forward? Go ahead, Bruno.
Well, on projections, I think we have to say quite clearly, you know, we're still on a trajectory which is close to 3 degrees warming. I mean, that's probably where we're heading for the moment. And which means, and considering the lag time there is between, you know, action and full impacts of the action, it is highly likely we're going towards the scenarios that have just been mentioned, which is probably, you know, beyond 2, beyond 2.5, etc. I mean, that's the course we're on. And if basically every player in society, institutions, organizations, companies, don't play their role to take the responsibilities on what they control, what they influence, you know, it will be very, very difficult. And of course, I mean, you know, there's always this. We have to be very careful on the blaming part. It's very important to state the role of the fossil fuel industry, obviously, but we mustn't forget that consumer organizations are massive demanders of these fossil fuels in everything they do. And as long as they don't, you know, confront the reality of what deep decarbonization means, they will be fueling this system, which is actually today contributing to the worsening of the crisis. And it's extremely clear. So I think, you know, there's really a call for action to act on what you control, basically, because less than that is going to be difficult. So maybe I'll pass the floor to.
No, very briefly to to everything, first agreeing with everything you said, Bruno, but also two things. One is that I think one of the big challenges that we do continue to confront is the precarity of data, especially when it comes to the climate and health co-impacts that we are talking about. It's still very feeble. The fascinating presentation in the previous session that we just saw in terms of air pollution, you would be gobsmacked that entire studies that have been done make no connection explicitly to health impacts. And that's the startling fact that we are dealing with. There is a reason why this year was the first ever health day at COP that happened. And so, there are, the Countdown Lancet report, the new commission report that Andy Hines and others have been working on have looked at some of the data, but we are still not making those connections explicitly. We still talk about, when we look at in terms of 1 million preventable deaths when it comes to malnutrition, we are not talking about the 10 million preventable deaths that are happening because of NCDs, which are directly related to consumption patterns, food and agriculture, and about the climate impact. And that goes to your point, because I think the problem that we do continue to unfortunately suffer from is that these conversations are still somehow imagining that this is a future problem. These are very sleepy conversations that we are happening. So I'm sorry, the sense of urgency is just not there in the room often. When you are sitting with people talking about these issues, whether it is in energy transition, food security, urbanization conversations, they're not. So, a lot of people talk about we need a sense of hope. I think we need is the sense of courage to say and do the right thing, because I'm sorry, the data is staring at you in your face. What we are not doing is taking action. And that for me is willful negligence that governments are engaging with. And that's where a stronger understanding of both the political economy, but also the centers of power become extremely important to understand how do you shift that to come to this holistic approach that planetary health is asking for. Because unfortunately, other than that, this is the same old conversations then we are having.
Anybody else in the panel want to speak?
Just
Done.
add from a different point of view, I think I'm not talking from a science point of view, but from a people's point of view, community point of view. So there are two things to think about. If you are a humanitarian worker, your dream should be that you would be out of a job one day because you are being successful. But then, as Rajat said, like there are 20 years of displacement. So it seems like we keep responding to emergencies without thinking long term. And in that, I think we need to think about, first of all, how do we as everybody, that we all take responsibility about our own greed, right? Because societies are pushed through, as you said earlier, like the consumer organizations, they are driven by greed. People are driven by greed. The media, everything is pointing towards destroying the planet. And I think if we can think about that through education, through our own action, and that would allow nature to recover itself. I don't think we can get the planet to heal. Planet will heal itself if we take a step back. And I think that's everybody's responsibility. And we can't say it's for the future. No, it's us. We need to take the responsibility, and we have to say, okay, we are taking our own responsibility. And when we talk about responsibility, it's our ability to respond. Can we do that? Thank you.
Thank you. I'll just make a quick point because there was an issue I wanted to raise, which I failed to do. And the first thing is, in MSF, we talk about alleviating suffering and restoring dignity. And part of dignity is elevating those voices from the people that we're assisting, from the communities, from the patients, from the community health workers. And so to your point, about, not sounding the alarm, well, it has to come from the ground up as well. And as MSF, I would challenge that we're not sounding the alarm. We're sounding the alarm about all kinds of things around the world. And do people care? Some do, some don't. But I think that, you know, the best we can do is, you know, as you say, you know, do what we can under our control. But also, I think individually, I think your message is so important about lifestyle. What are we willing to give up, you know, as consumers of fossil fuel products? And that's my off MSF line, but, you know, I believe this is
I believe.
really important.
I think, Peter, you have a comment as well.
Yeah, thank you so much. So I feel that a lot of people are really naive thinking about climate change and the effects of it, because people always feel like it's out of sight, it's out of mind. So I think in Malaysia itself, that movement is really slow. And to answer that question, I think humanitarians are very optimistic. So I think they want to achieve. Okay, maybe I'm wrong, but hopefully that, yeah. So we are hopeful that
new
we will be able to achieve it, to actually have some climate action, and also to regress on the impacts on the planet. But I think we are also very realistic as well. So in Malaysia, the government is actually looking into decarbonizing healthcare. So for Mercy Malaysia as well, we are looking into ways of decarbonizing our practices as well in terms of mobile services, because I think one of the things that humanitarian actors do is a lot of mobile services, and how are we reducing that impact in terms of healthcare on a global scale. So that's one of the things that we are doing realistically and also optimistically, and hopefully there will be a movement, and there will be a siren that will go on, that it will impact each and every one of us, and hopefully it will not be too late once we actually realize it's impacting us.
Thank you for that. I just wanted to also answer myself on the projections element. It's one of the things that we're doing now is really looking at strategic foresight and looking at scenarios, not from what we know and saying, okay, there's a scenario on cholera, but the compounded scenarios that that brings, whether it's digital threats or the new economic, the technological advancements and all those, and how do you interpose those, and what is it going to create us, and what scenario will it look like, how those scenarios come together, those threats come together, and you then look at all the plausible features that is ahead of you and try to go for the preventive one, preferable one, and you backcast. So this is a tool that we're trying to introduce now as something to look, to project much more forward than we are today, while still addressing today. So those priorities are hard. I'm going to take one or two more questions on the floor as last, and then I'm going to just have, while I'm doing that, I'm going to ask the panelists to have one word, last word, and then I'll wrap. Yes, down here.
So kind of building, yes-anding the question about the projections. So you do your scenarios, and I mean, it's okay to maybe pick the one that you want to work towards, but the reality is that, you know, you have to kind of pressure test all of your operations against multiple scenarios, you know, this kind of RAND approach to decision making. But my question is really about more, what do you do with that knowledge in terms of targeting the always limited resources that are available to the humanitarian sector, but also being cognizant that something's got to give, that business as usual is, I mean, the sector is a colossal failure. I work in the humanitarian sector, and I mean, even the little statistics that, you know, we're sharing, I mean, okay, so it was 10 years ago, there were 20 million people food insecure across the Sahel. That was absolutely unacceptable. So as of last week, there are 35 million. So, I mean, we are failing. There are more people who are actually suffering, you know, deeper and more complex risks. And we've got to figure out a different way to address it. So one is this idea of anticipatory action. Exactly. And of course, there's a lot of reputational risk if you're basing an action plan being mobilized based on probabilities. So, I mean, you have to make decisions. All right, so there's a 50% chance or there's an 80% chance. If we're talking about saving lives, when you actually go to the humanitarians and ask them, they're not going to wait until there's an 80% risk that somebody, that you're going to lose lives. They're going to take the reputational risk of maybe it's going to be a fail, acting in vain, let's say the storm system, takes another track, or the drought is not as intense as you thought it was. So those investments, I mean, you can say that they're squandered, but no, if you take that longer view of where are we going, then they are actually an investment in that longer term, so-called, resilience, strengthening the capacity of communities to cope themselves. And I think this leveraging of the power of humanity is also, it's all connected with we're on kind of, the big data horizon. Access to information is being democratized through simple things like cell phones. And we don't invest enough in the power of those so-called beneficiaries, IDPs. We have all these terms. IDPs, if they're going to be living in camps for 25 years, that's their community.
Exactly.
And those people are way more resilient than half the middle class, North Americans and Europeans. They know how to make a fire. They know how to cope.
Sure.
They know how to shift their livelihoods. So if we want to be doing things better, I want to ask you, where do you see the points of disruption in the humanitarian sector where there's willingness to take the risk of doing something differently? Even something as obvious as anticipatory action has been uphill, for the last decade or so that we've been trying to do it. I want to just call out, WFP and OSHA, they are full on doing it. So,
Totally right. We are actually doing.
Sorry, I have to
There-
rant.
There is there is a lot of anticipatory action work now that's being looking at AI, using that as well, and bringing in the community. I'm just sparing the group unless they feel urgently to speak to that. But what I wanted to raise here is, before I give the last words to the panel, and also to answer a little bit to that, is actually the disruption should be the voice of the community. And I think what we're hearing now from the community is we're not asking you to speak for us, is we're asking you to give us the space to do that. And that's what we're looking at. And this is more of a listening, more of allowing them to speak for themselves, etc. And I am a humanitarian with hope. And I think we are working towards that. And one last thing, I think as humanitarians, we are part of humanity. And I think what we're dealing with is a crisis of humanity. And I think we need to give each other hope and voice and solidarity and equity together. Having said that, I will give the panel, they have one word. Okay, you can have 2 or 3. We're going to start with the young one.
Thank you so much. My word is our planet, our future.
Nice. Bruno, can you top that one?
One word will be difficult. No, I think, humanitarians have never claimed to solve the causes, and we're in front of a situation where needs are going to be much greater than they've ever been. And I think humanitarians should be transparent on the fact that they won't be able to respond to these needs. And what can be done is considerable reinforcements of national systems, local communities, safety nets with international systems, and humanitarians will continue to play a role, but it cannot be up to the situation that's unfolding. And finally, I would say
that was 100 words.
in the health sector,
He doesn't know how to count.
everyone has to realize it's only a small minority of institutions which are actually on track with deep decarbonization or environmental commitments. It's a very small minority. There are a few organizations doing a great job.
Right,
and it's
so
time for everyone to go down this track, because
Okay.
I'm worried about the proportion.
that's his word. Everyone, it's time to go down this track.
I'll
Rajat.
have two very quick things. One, I take a lot of hope from the fact that we actually have MSF talking about planetary health.
Oh, well.
So
yeah.
no, kudos to you guys. You know, the fact that we have the International Medical Director, the Deputy Director General sitting here talking, we need more of this. We need exactly more of this, and we need this at scale. So the word I was going to say is courage. And I think the courage that MSF is showing, I hope others in the humanitarian sector would as well.
Thank you.
So basically, in 1994, when Rwanda happened, the humanitarian global budget was $25 million. Today, as we speak, we are talking about $117 billion. What resource problems we are talking? In that, I think we all need to take responsibility. We all need to collaborate as equal partners. Thank you.
Ah.
There's one very challenging thing we're working on, and this would be disruptive for us as MSF, and that is to really work with patients and populations, communities we work with as partners. So for me, it's the PPP approach, and for me, it's about really truly listening to those people that we're working with. So thanks everyone for your time and coming to this session.
With that, I'm going to close. I'm going to end with what Carla Sagan has said, that there is perhaps no better demonstration of the folly of human conceit than this distant image of our tiny world. To me, if it underscores our responsibility to deal more kindly with one another and to preserve and cherish the pale blue dot, the only home we've ever known. So let's save it together. Thank you, everyone.